When it comes to Ebola, health experts say they do not expect to see transmission in the general public. The patient being treated in Dallas had traveled to Liberia recently. He is in isolation right now. Doctors are working to track down anyone with whom he came in contact. The ambulance crew that did treat him so far testing negative. Doctors tonight tell me this is likely the first of rare, sporadic imported cases.
Thousands dead. Thousands more infected in West Africa since the Ebola outbreak. The lone case in the United States has concerned patients calling Dr. Jack Ross, Director of Infectious Diseases at Hartford Hospital.
This is not unexpected at all. You have a large number of cases in West Africa. In our life today, we are 36 hours away from any place on this planet.
With air travel as the main vector for Ebola to the U.S., hospitals in Connecticut, Dr. Ross says, stand ready for the possibility of an imported Ebola case.
The hospitals in Connecticut would isolate in place and treat in place.
But first, questions from frontline medical workers, such as any recent travel to the affected region.
If the answer is yes to that, the next step is you isolate and you ask further questions. You would then ask, have you had contact with somebody that has had direct contact with somebody known or suspected to have Ebola? Did you attend the funeral rites? Did you serve as a healthcare worker in these areas?
The general public, Dr. Ross says, is not at risk for contracting Ebola.
Prior to the time that someone actually is symptomatic, they are not infectious. So you could sit next to someone on a plane with no symptoms. It could be incubating for 2 to 21 days, but you would not be at risk.
Well, Dr. Ross points out people are more at risk for catching the flu than contracting Ebola. Now, in the Texas case, it was not until the patient returned the second time that the hospital learned of a West African connection.
Wow, a late delay there.
Yeah.
Lots to absorb there.